My name is Molly Kosoglow.
Becky Rock.
Tyler Houseknecht.
Carey Mancuso. Melissa Poland. Sarah Walbolt.
Allison Smith. Marianne Sromoski.
I oversee transfusion safety, patient blood management, and bloodless medicine.
It wasn't too long into it, I found it became my calling. And I was encountering people telling me about their fears and concerns regarding their blood health.
It also came from personal experience, being a woman with menorrhagia and fibroids, needing a blood transfusion in the past, iron infusions in the past.
My mom took in a dear friend of ours who was in her 90s. We called her Aunt Ada. Before she died, she pulled me in her room and said, "Missy," that's my nickname. She's like, "You've been a good nurse to me."
My father experienced a major gastrointestinal bleed. He was choosing that he did not want a blood transfusion. That was my first understanding that there's a lot you could do to safely manage and preserve a patient's own blood and regenerate it.
I literally moved 2.5 hours away to work at a facility that had a bloodless medicine program.
There was not only a cost-saving initiative, but it is a win-win. It's the right thing to do for the patients as well as the organizations.
Once we started looking at what we knew about blood and what our hospital system was doing with blood, how we were using it, really got me thinking about what do we want to do that's best for the patients.
We need to promote blood health, that concept, and patient blood management. But it's the patients who I want to involve in the treatment decisions. Here's your options. Here's what we might be able to do. What would you like to do?
The medical establishment seems to have come around to treating Jehovah's Witnesses in a way that would boost their blood health just in case. And I wish we could apply that to every patient. If those extra therapies are helpful to them, then we should also be offering these to the general public that maybe would accept blood.
There are a lot of assumptions made when people initially hear the term bloodless medicine. One of the biggest misconceptions that I see is that they think it's simply checking a box, yes or no. And it's way more than that. I had 2 emergency cases that came in the same day. It was a life-threatening situation that he was experiencing. This gentleman had a medical directive. Everything was clearly communicated. The outcome was wonderful, and there was no delay. Patient example number 2, she also came in an emergent situation. She had not thought about any of this. She was in pain, and she was stressed, as you can imagine, with a diagnosis. Situations like that help us understand why it's so important that we have a plan in place, because when we are faced with it, we do not want to have to make life-altering decisions just before we're going into surgery.
It never ceases to amaze me, the kind of light bulb moment that comes on when I'm discussing their lab values with them. So just that aha moment is just beautiful every time it happens.
And for so many of the patients we've seen is once they've had the opportunity to get their anemia treated, get their iron replenished, we're seeing new life and rejuvenation for the patient, which is just amazing to watch that transformation.
When you do a job that you know affects patients' lives and makes them feel better, you get constant positive reinforcement. Your institution sees enough value in it to pay multiple professionals to do it. Like, it just works. I love my job. My job is amazing.